It was a Sunday morning, and that morning I had gotten up to make breakfast, and we were getting ready to go to church. And the kids ran into the kitchen to tell me that Mommy fell, and I was trying to pick her up, and I felt that her body was kind of limp. And when I was talking to her, I started noticing that her speech was on and off slurred, and the left side of her face started to droop. And so I asked her, I said, "Are you okay? I think you're having a stroke." And she said, "No, I'm not having a stroke." I said, "Yeah, I think you are."
It comes over the MDT, our computer in the ambulance, that it's a mid-30s female who's experiencing stroke-like symptoms, which is extremely rare considering that strokes tend to be older people. And we see the patient for the first time, and she's not doing well. You could tell just looking at her that this, as improbable as it probably is a stroke. The patient said, "We want to go to St. Luke's in the Woodlands." And it worked out perfectly because St. Luke's in the Woodlands is a comprehensive stroke center. We entered the hospital and the doctor was standing right there. And since we'd called ahead and let him know that we were coming in, he already had an idea of what was happening. He just needed to see the patient.
As soon as she rolled in the front door, our team met her, including an ER doctor and a neurologist. The patient was immediately evaluated, everyone agreed she was having symptoms of a major stroke. From there, she was immediately rushed to the CT scanner. Once we saw the results of the CT scan, she immediately had a clot-busting drug infused in her vein that was go to the brain to dissolve the clot. However, as often the case is with these very large occlusions, that doesn't work. The clot's just too big. So while this was all happening, our team was already in the cath lab, setting up in case she needed to come up for surgery. Once we realized she needed to go up for surgery, she was immediately taken up to the cath lab where we prepped her and restored blood flow to the brain. And we did this in a very rapid and timely fashion. This allowed this brain to live rather than having a major stroke. After Janie's surgery, she immediately went to the intensive care unit where we watched her that night. She made a dramatic and almost immediate recovery. The blood flow was restored to the brain before major injury was done.
After surgery, she was able to move her arm, move her leg, and also was able to speak. And so that to me was somewhat of a miracle.
As soon as she got into the intensive care unit and got to be stable, then the next step happens, which is the team arrives to try and find out why this happened. Neurology, cardiology, testing on her heart to understand what caused the stroke.
It was pretty impressive to me, just the amount of people involved in her care.
We have a lot of doctor visits after we go home, so we came to hospital many times.
Ultimately, it was found that she had a very rare connection between two sides of her heart, which we know when you have that can cause strokes even in young people. She had that repaired here with our cardiology team, and that should prevent Janie from ever having a stroke again.
We chose St. Luke's in the Woodlands because it's the only comprehensive stroke hospital in northern Houston, and I'm very glad we did.
It's extremely important to get to a stroke patient in a timely manner. As our medical director, Dr. Dixon, says, time is brain.
One of the advantages of being a comprehensive stroke center is all of these services are in one place and they can be happening all at the same time. In some other places, she may have been able to get the clot-busting drug, but she then would have had to go back onto EMS, transport to another hospital to get the surgery. Whereas at the Comprehensive Stroke Center, that's all at the same place and can be happening in parallel. Without these types of interventions in a very timely manner, this could very easily have resulted in someone that needed to live in assisted living facility, would not maybe be able to speak properly, move one half of her body, and certainly wouldn't enjoy the full life and quality of life that she's currently enjoying with her family.
You can't recover 100% from a stroke, but you can do 99%. And for me, that's a big difference between, having somebody who is can't function and do the normal everyday things versus somebody who's gotten her life back. And so for that, I'm forever grateful.